good, okay. So just to recap, when your client, hopefully, when you're coming into the room, the client would be in this position, right? Hopefully, I've said, because you have to show them. So do you do that at home? Take the towel and show them how to get undressed? Yeah, and how to lie down? Would be kind of cool, yeah? Right, so what do you do next? I'm going to teach you a technique for toweling. And it's very important because your client might be cold and you need to cover them really well. So one towel, even a big one, is not enough. So the towel technique I would do is called the T towel. T like the letter T. So it has one, the top towel is long across the body, this way, side to side, and the lower towel goes downward. Before that, we have to talk about pillows. When you use pillows on them when they're facing down, put the pillows in such a way that the big toes sort of touching the table a little bit. Yeah, this way is not good. Do you feel the difference, Ingrid?
Yeah.
Yeah, and that way is not as comfortable, especially if it comes to be above the knees. So you have to be quite specific about where the pillow goes. Yeah, good. Now the second towel, here it comes. So the second towel you're putting along the body, yeah, not across the body, but along the body because the legs are longer, and you do it in such a way. You're taking, and this should be practice at home, and after a few months to be automatic. You're taking the two towels, you're shifting it up to here. The lower towel, you're tucking under the underwear, and the longer towel this way. Okay? Now, why do I like this towel technique? Look at few scenarios. First of all, this client is really long. No problem, look, you have still a lot of places. Second, imagine that the client likes their hand to be out. Okay? Still cover. So in any scenario you can work, the towel still help you. You can put your hands back. Now, after the hold, when you start massaging, you do very simple thing. You come from here and you glide it. Yeah? And then if you want to come back and to cover it, so it's kind of neat. Sometimes you see clients with the towel sort of knit all over, and then it's sort of interrupting you, and it's kind of unpleasant. Certain body parts are exposed and cold, not great, yeah? So try to be really neat and simple. Instead of coming and starting to move the towel there, and okay, come on, you know, do it in one go, you know, just come from here. The client would also feel kind of, you know, easy. You're doing it and that's it. You know, and you coming, bring it back, the same. Okay? Now we're starting the legs. Yeah? So, just to show you how things work, imagine we started the treatment. You do the back, and then you move the towel. You do effleurage here, pétrissage, and then shoulders, neck, and then you bring it back to here, and then you want to do the legs. Right. Now, do you think you need to do a hold here again, or it's enough one hold that you've done?
It's enough one hold, I would say.
It could be, yeah. Some people saying, okay, you feel that you've done it. The client knows you. Go to work. Some people saying, oh, you know, just do that. Just sort of like, don't strip the towel too quickly. Just touch there, do a few touches, or even nice hold, quickly and then start. Up to you really. You decide what works for you. So how do you do the towels for the lower leg? You fold the pillow this the towel this way. Then you take the leg a little bit outside. That's it. So now there is a bit of distance between. It will be easier for you. Then, and this really need practice, you take the lower towel and you move it diagonal. But you're still covering that leg. Then you go and tuck this underneath the other leg. So it creates a clear area where you massage and where you not. Should I do it again?
Yeah.
Yeah? So, and that's really neat practice, yeah? So you're taking this towel and fold it up. You're taking that towel around here and around there, and then you move it diagonal. Yeah? And then you just come and tuck this under. Yeah? Now, then you start with which technique? Good. So, what's the benefit of effleurage?
Relaxing muscle. And the oil.
Spreading the oil.
Spreading the oil.
Warming up the muscles.
Warming up the
Skin.
muscle, yeah. More the skin actually, but also a little bit the muscle, yeah.
Getting the client ready for the process.
Yeah. Getting the client ready. Do you think the client relax with it?
Yeah.
Yes.
Yeah.
So the client relaxes. Good. Now what I really need to check with myself if I do it slow enough. Because after talking and explaining, I can start, doing it. And so you have to hold yourself to do it quite slow. Good. You can do it in two ways. You can do only the leg. Or you can do only the thigh, you can do it together. But what I want you to really see, and that's very important, is the movement. Not much with the hand actually. It's a lot more with your body. And actually you see that the legs are quite long. So sometimes you really need to use your whole of your posture. Sometimes if I have clients that are kind of even bigger, I will do that. So the leg would need to change if I want to do all of it. Yeah? Good. So, by the way, which bone is in here?
Heel bone.
Heel bone or calcaneus? Good. Good. So I warm up the tissue, spread the oil, relax the client, help in blood circulation. Yes. I'm almost like squeezing this muscle underneath and taking it down. Good. Around the knee, on the back of the knee, I'm kind of more superficial and then go deeper. Good. I like to see the body really in 3 dimensions. So I don't do just the top. I try to really cover the sides. So I have more contact time. Do you see how I can almost like lift this muscle up? Yeah? So even in the effleurage, give it a full cover, really nice cover. Good. Now I start work with petrissage, right? So I will start with the leg. Even if you want, you can just warm it up a little bit and leave that covered, and then after you come, you can do it again, right? So first, what do you think this technique will be called?
Ringing.
Ringing. Good. Yeah. Good. So am I moving the tissue? Yeah. Good. Which one is this one now? Figure of 8. Yeah. Good. Yeah. You can do a bit of lifting. How is the pressure, Ingrid?
Yeah, good.
Yeah. Good. What other petrissage technique you have? You have finger kneading. In a way, I start feeling a lot more when I do the finger kneading. I start feeling, okay, where is the tension? So it's very kind of slow and moderate, you know? Don't try to feel, oh, where is the pressure? Where is... And you start accelerating with no really reason. Yeah? Good. Other technique, I can do the knuckles. It's almost like ironing. I can do the knuckles with two hands. I can do it this way or that way. Good. It's kind of nice coming around and try almost like to lift the muscle. Yeah. Good. So all this wonderful work, and now we have the new technique. Remember the movement? Now come a bit closer and see what happened to this muscle. Do you see it's almost like wobbled? How does it feel, Ingrid?
Nice.
Yeah, good. It's almost like coming and shaking it in a way, yeah? Good. So you can do that. Yeah? Pounding. And let's, for the try, do it on the towel. Which one feels better?
That technique, the towel's better.
With a towel?
Yeah.
Yep, okay. We're still on, most people like with a towel, right? Mm-hmm. Not all. Okay, so you can kind of quickly cover it. Yeah. Good. Now I want to show you something slightly different that involves moving. So we don't yet do joint mobilization, but at times it really makes sense to work with this technique. So you taking the leg, and now you holding it, not in here, but do you see that groove in their leg? Sort of there. And then you start moving it. Now you're trying to really wobble it as much as possible. So it's not that, but it has a rebound like basketball, yeah? Like bouncing a basketball. So you see that this muscle becomes a lot more relaxed, yeah? Yeah, good. You can do it probably in this position. Yeah? But it's nice to also feel it because after finishing, you can massage the muscle in this position. Good. Now, if you start being, one thing I want you to be considered is that if you do this technique and you're not stable yourself, what would happen that they don't trust you and they will contract the leg? Can you hold the leg there? And then something like that happens. So you're trying to move it and it's kind of hard. So you know, okay, it's not very stable. So take a little bit more control over it. Okay, and then you're coming onto the thigh itself, and here you have muscles on the back, on the side, and on the inner side. So again, you can start with, ringing, figure of 8. You can do a bit of lifting. You can do kneading. Because on the inner part, I'm not going to go higher, I need to come from that direction, yeah, and massage either from here or from here. Once in a while, another effleurage. Then you can do the whole tapopment on the whole of the leg, yeah? Even with, remember that, on the heel. And finish with a nice hold.
You wouldn't bring the foot into it at this stage.
Sorry?
You wouldn't bring the foot into it at this stage.
After
Massaging
finishing. After
massage.
finishing,
Right.
then you can bring the foot back and then do the other leg.
No, I meant massaging the foot.
Oh, it will be in a different class. So
Right. Okay.
we will do, but in a way, we
Right,
build
okay.
it in a bit different way. Okay? Shall we do that? Then after that, we'll do the buttock. Just because we'll do it with towel and without, so it's going to be a bit different. So far, concentrate on that area. Okay? Do all the technique, and one group would be the one with Ingrid here. You will have 2 people, so 1 in each leg. Okay? Lucky one. Fantastic, thank you. Yeah, good. So we work on the leg thigh. Now we look at the buttocks. Can you bring please one of the skeleton? Yeah? So when it comes to the skeleton, you can see the bones, and it's kind of nice to know where we are on the bones, yeah? Because we just work on the skeletal system, so massaging that area would be kind of good. So let's look at which bones you can feel, yes? Which bone is on the outside? Start with an F, fibula, and in here, tibia, femur, and the kneecap, patella, good. This bone in here in the center, sacrum, and the side is hip bone. Hip bone, great. So come around here and let's have a look at the hip. Yeah. So here we have a group of muscles called hamstring, and they're going up and down. Yeah. Now here on the hip, there are few group of muscle, and they go more lateral, this way. So actually, a lot of the treatment would be this way or that way if you go across them. Yeah. So which bones can we feel? We can feel that bit that's called the iliac crest. We can feel the sacrum, but here there is the big muscles. So you might not be able to feel a lot of it, but you can feel that part of the femur. It's called the greater trochanter. Greater trochanter. This is the lesser trochanter. That bit is on, can you feel it on yourself, on the outside of the hip? Yeah. It's a little bit lower than you think. Yeah? A little bit lower than you think. Yeah? So that bit. The rest is kind of padded, really, with muscle, but you can feel also the sit bone over here. Okay? So now, let's have a look and see how do you do that. First of all, I want to do it with a towel. So you take the towel over here, and then you could just say before, Malika, I'm going to work on your hip. Yeah. Let me know if it's tender or uncomfortable. Okay. So if she starts feeling uncomfortable, I give her sort of a permission to say uncomfortable. I will move to another place. Yeah. Probably, it's kind of, it's an area that is great to work, but some people would feel uncomfortable about. So it might not be on the first time that you would work on the client this way. You might want to take time until they feel comfortable and then do that. Yeah? Good. So first what you can do is you can work with your knuckles, yeah, and you can start with a pet massage. If you work on the towel, you can't glide, right? You can't do it because there is no oil. So you need to do more like pressure point, pressing on certain area and leave it, pressing on certain area and leave it. How is the pressure? Good. Good. So what I want you to start actually is to feel the sacrum, the edge of the sacrum. So the sacrum is here and you feel the edge of it. And then the femur, the greater trochanter. Can you show Abby the greater trochanter to everybody? Yes, this one, yes. So it's kind of here. So I want you to feel that one, and you're massaging in between.
So you're on the side, more the side of the buttock?
No, they actually the back of it. The back of it.
Oh.
Yeah? So from the greater trochanter, I work backward.
Right. Okay.
Yeah? Can you show it from here
So there.
to
that's
there? Exactly. Yeah? So again, you choose an area and you're circulating it a little bit. You can work with your knuckles or you can work with your fist. Because it's kind of a big muscles, it's okay to work with these. So kind of very little movement and a lot of leaning in and then relax. And leaning in and then relax. Good. Good. After that, well, you can't do, hold is not going to be nice to work in. Hold I would do on the sacrum, for example. Then you can't do much of effleurage, but you can do pet massage. If you want, then you can do percussion. And here, onto the other side, hacking, cupping, a bit of, tip of the fingers, percussion. You can work on the other side. So here I work on the same side. Here you can work on the other side because look, your hands sort of like fit in a lot easier. Yeah? So what I want you to appreciate that I'm actually so close on the table. I actually put another hand here and I'm leaning so my head is actually right into there. Probably you are working there. So your head is around here. So it's a lot, for me it's a lot easier because I feel comfortable to come closer and actually lean with my body. Good. You can work the opposite and now pull it towards you. Yeah? So that's a finger kneading. Good. Finding another area. How's the pressure? Good. Can I under the towel? Yeah. Okay. So another way to work on is to work under the towel. And how do you do that? You're taking the leg a little bit outside. Pretty much the same as what we did before. And then what you do is just you taking and draping the towel this way. Yeah? So you're taking a bit of oil and say you do the whole effleurage. Yeah? onto the leg. Then you can do more effleurage on the gluteal area. And then from there, continue with the petrissage. You might want to come onto the other side.
Yeah.
Round. Yeah. So, I like to work with the knuckle in this area because this area is kind of small anyhow. So you want to have the fingers not going to places they shouldn't. Yeah. So working around this way. Yeah. Or you can come from the other side. And then it's kind of a lot easier to work on the other side. So I feel the greater trochanter. Yes, this femur thingy in here. And I'm working from here to that direction. Yeah, with the tip of the fingers or with the base of your wrist down. Again, put your body kind of above the client's body. Yeah. If you're working here, it's going to be very hard for you to apply pressure. Even one leg up. Do you see the legs going up in here? It allows you actually to bring yourself up and over. And then from there you can continue. Yeah. Good. And then after that you can do the hacking. So basically working on the towel, a bit of effleurage is a squarish area. So effleurage and then a lot more petrissage to that area. Yeah. With opposite direction, knuckles, fist. You can do more like turning of the fist, yeah? There is not much gliding you can do. It's not like figure of 8 and it's kind of short, these muscles. Yeah? And then hacking, you can do the pounding here. Should we give it a try?